Good morning. Thanks for tuning in to today's reading of the Acadiana Advocate, a public service by AOC Community Media. We may have a volunteer again tomorrow if all goes well, so hopefully we'll have Bruce Cohen here on with us. But for today, I'm Mandy Ao, and you are stuck with me. We've got lots of news to cover today. Of course, most of it to do with COVID-19 and our community and state response. And we'll try to fit in some fun stuff like some horoscopes later on in the hour if we're able. You can catch us every weekday. We do this from 9 to 10 on AOC 1 as well as Cypress Street Radio, so you can carry us along on your phone or in your car at aocinc.org/CS radio. Let's get started. Cases climbing in rural areas of Acadiana. Nursing home worker in Lafayette tests positive, by Claire Taylor. Coronavirus cases are increasing in rural Acadiana parishes, particularly in St. Martin and Iberia parishes, while a Lafayette nursing home confirmed Monday an employee tested positive for COVID-19. Dr. Tina Stefanski, Region 4 Medical Director, Office of Public Health, said Monday the state health department is seeing more cases of COVID-19 in rural communities in Acadiana. Nationwide, most cases of the virus have been concentrated in urban areas with dense populations, she said. We are very concerned, Stefanski said. The message is, as we embark on this Holy Week and people want to congregate, as we're doing these case investigations, we're seeing lots and lots of clustering among friend and family groups. She advises all Acadiana residents to keep their social circles small during their Easter celebrations and take care not to potentially expose another group of people to the virus. We're very concerned we're going to see this growing spread, especially in our rural communities, Stefanski said. The 7 parishes that make up the health department's Region 4, Lafayette, Acadia, Evangeline, Iberia, St. Landry, St. Martin, and Vermilion parishes saw a 10% increase in cases between noon Sunday and noon Monday, an increase of 54 cases, bringing it to 604. Only 13 of the 54 cases were in Lafayette Parish. Since Saturday, St. Martin Parish recorded a 40% jump in positive cases from 64 reported Saturday to 90 reported Monday, an increase of 13. Iberia Parish also saw a 22% increase since Saturday from 68 to 83, a jump of 14, plus another 2 deaths, bringing its death toll to 5. While it's not in Region 4, Jeff Davis Parish saw a big jump in cases, up 133% since Saturday, from 9 reported Saturday to 21 reported Monday. Jeff Davis Parish also reported its first death related to COVID-19 on Monday. Lafayette Parish saw a 5% increase in confirmed coronavirus cases Monday, marking the second day it recorded a single-digit percentage increase. Lafayette Parish saw an additional 13 cases since Sunday, bringing it to 260 confirmed cases. A 6th death was reported Monday. The Louisiana Department of Health at noon Monday reported a 14% increase in COVID-19 cases in the state, up 1,857 cases to 14,867 positives since the first case was reported in Louisiana on March 9th. An employee of a Lafayette nursing home has tested positive for coronavirus, but none of the facility's residents are displaying symptoms, a spokesman said Monday. About 10 to 11 days ago, a female employee of Magnolia Estates Nursing Home on Dulles Drive became ill during her shift and went home. According to Bob Richardson, Chief Compliance Officer for CCI, the company that owns Magnolia Estates. The employee, whose job put her in contact with residents, became worse at home, took the coronavirus test, and 10 to 11 days after her symptoms surfaced, found out she was positive, he said. The facility is following state health department testing guidelines, Richardson said, so unless a resident shows symptoms of COVID-19, they will not be tested. The company reported the positive employee's case to the Louisiana Department of Health and Hospitals, Richardson said, and attempted to call or email the families of all its residents. Long-term care facilities are required to report positive cases to the state, Mindy Facane, Public Information Officer for the Health Department, said in an email on Monday. They don't appear to be required to inform the families of all residents if a cluster of positive cases, a cluster being defined of at least 2 confirmed cases, occurs at a long-term care facility. Each facility makes its own decisions about how to communicate with families, Fasain wrote. Stefanski said Monday the state health department works with the families of nursing home residents who test positive and encourage nursing homes to notify the families of everyone in the facility. She was not sure if the facilities are required to notify the families of all residents. Last week, the health department stopped reporting the names of nursing homes with COVID-19 clusters. The state will only report the total number of clusters at long-term facilities in the state, not broken down by parish or region, updating the numbers twice a week. On Monday, the department reported 363 COVID-19 cases and 103 deaths in 70 Louisiana nursing homes out of 436 long-term care facilities. These facilities care for thousands of Louisianans, including older people and those with underlying medical conditions that put them at higher risk for complications and death from COVID-19, the Department of Health website states. Before the positive case, Richardson said Magnolia Estates screened employees every day upon arriving for work, including taking their temperature. Now, he said, employees are tested at the start of their shift and halfway through their shift. Residents are checked 3 times every 24-hour period for fever, shortness of breath, sore throat, and respiratory problems, Richardson said. So far, there are no positive cases among residents. We've been very fortunate. In state news, Edwards says flattening the curve may have begun, an article by Sam Carlin. 2 weeks after instituting a stay-at-home order for Louisiana's 4.6 million residents, Governor John Bel Edwards on Monday said the New Orleans area was no longer on track to run out of ventilators and hospital beds this week, as the state sees what officials hope are the first measurable signs of the outbreak slowing. The governor cautioned that officials still need several days of data to confirm their hopes that they are seeing steep restrictions on face-to-face contact bear real results, and he warned residents not to let up on complying with those measures. We are hopeful we're starting to see the beginning of flattening the curve, Edwards said, taking his most optimistic tone yet since the coronavirus began ripping through New Orleans and elsewhere. We have to keep doing everything we've been doing to have the best possible outcome. For weeks, Edwards' administration has projected the greater New Orleans region was on track to run out of ventilators and hospital beds in the first 2 weeks of April as officials raced to stand up facilities to house patients and land badly needed ventilators and other equipment. But hospitalizations and the number of patients on ventilators has flattened in recent days, and Edwards said the area is no longer on track to run out of these resources this week. He declined to provide a new date for when that is projected to happen. Hospitals are dealing with fewer patients that require ventilators than initially projected, and patients are spending fewer days on the ventilators, according to Edwards. The number of new admissions to hospitals has fallen, and the rate at which people in Louisiana are dying of the disease, which was initially much higher than other areas, has started to come closer into line with other states. Still, Louisiana has one of the highest rates of death from the virus in the country, and half of the top 20 counties or parishes nationwide for deaths per capita are in Louisiana, an alarming increase from a few days ago when 6 parishes were on the list, compiled by University of Louisiana at Lafayette economist Gary Wagner. St. John the Baptist Parish leads the nation by far in that metric. Orleans, St. James, West Baton Rouge, Jefferson, Plaquemine, St. Charles, Allen, St. Bernard, and Iberville parishes are also on the list. And new data released by the Louisiana Department of Health shows wide racial disparities, African Americans comprising 70% of the deaths in Louisiana. As of Monday, Louisiana had confirmed 14,867 cases of the novel coronavirus and 512 deaths, putting the state near the top of the list nationwide for cases and deaths per capita. The figures represented an increase of 1,857 new cases, and Edwards pointed to Louisiana's relatively high rate of testing compared to other states, though the United States as a whole had a slow start to testing and has administered fewer tests than many other countries, hampering the nation's ability to respond to the pandemic. The U.S. as a whole has reported more than 337,000 cases and more than 9,600 deaths, according to Johns Hopkins University. Edwards said the White House has told his administration to stick with social distancing measures, including a stay-at-home order through April. The state's stay-at-home order, which shutters K-12 schools, bars, casinos, gyms, and a host of other businesses, is currently in place until at least April 30th, but Edwards has warned residents to prepare for disruptions to daily life for potentially months. The state is seeing encouraging data for the number of coronavirus patients in hospitals and on ventilators. Across Louisiana, only 6 more patients were in hospitals Monday compared to a day earlier, with the number starting at 1,809. The number of patients on ventilators rose by just 2 to 563. Alex Bio, Assistant Secretary for the state's Office of Public Health, said the administration has been tracking the number of deaths that take place each day instead of what it has so far released publicly, the number of deaths confirmed each day. Okay, those numbers, which will be added to a public state dashboard Monday, are showing improvement, he said. Coupled with the improvement in Louisiana's numbers are the fruit of furious efforts by the state and hospitals to surge medical capacity, especially in the New Orleans region. Edwards said the state has secured 753 ventilators in recent weeks and has distributed all but 200 of them. Of those, 350 came from the federal stockpile, where Edwards has asked for 7,000. And after officials rapidly executed a contract and began construction on a temporary hospital facility at the Ernest N. Memorial Convention Center in New Orleans, patients have begun moving into the facility, which will be able to house 2,000. Those patients will come directly from hospitals after being deemed well enough to leave intensive care to free up hospital beds. Those efforts and others to establish isolation sites, secure personal protective equipment, and staff testing sites have added up to hundreds of millions of dollars in state spending. As of Monday, Louisiana has spent a staggering $573 million on coronavirus response since the outbreak became known here, more than double the total from last week. According to a breakdown provided by the administration, the budget for the convention center project alone has grown to $109.5 million. Louisiana is slated to foot 25% of the bill for its coronavirus spending, which is expected to continue to increase, with the federal government picking up the rest. Commissioner of Administration Jay Darden said once the state spends $660 million, the split is expected to change to a 90% to 10% federal-state match. Officials hope to be able to use some of the $1.8 billion in federal stimulus money coming to Louisiana's coffers on its state share of the split. Even though federal law normally prohibits using federal money to match other federal money, Darden said the administration expected guidance on those funds in a week. The improving projections from the state came as a closely watched model by the University of Washington changed dramatically in Louisiana's favor over the weekend, indicating Louisiana had already hit its peak for the virus in terms of deaths and resources needed. But the projections from that model are out of step with the number of deaths seen in Louisiana on Sunday, and several more days of data are likely needed to determine whether the model is accurately describing the state of the pandemic here. And COVID-19 coronavirus, the latest, homeless advocates seek aid, hotels considered as an option, but funding needed, an article by Ben Myers. Homelessness in Acadiana was on the rise even before the coronavirus pandemic throttled the local economy, and advocates fear the pandemic will worsen the problem in 2 ways: by putting more people out of work while forcing shelters to reduce bed space. Hotels, meanwhile, are suffering dramatic cuts in occupancy during the typically brisk spring season. In what seems like an obvious win-win solution, the Acadiana Regional Coalition on Homelessness is trying to match people who need shelter with hotels that need occupants, but someone still must pay the room rates, even when supportive hoteliers offer discounts. The federal aid package known as the CARES Act could provide the needed funding with homelessness assistance grants, but much needs to happen before that money is in hand. The Homelessness Coalition is asking for donations in the meantime, but it has thus far raised only a fraction of what's needed. An average of 414 people experiences homelessness in the 8th Parish Acadiana region on any given night, according to a 15-month rolling average of shelter intakes and outtakes that the coalition tracks. The coalition's executive director, Lee Rochelle, said that it's close to a preliminary point-in-time count for 2020, though she said the final count for this year needs additional verification. That would mean homelessness in Acadiana increased about 15% over last year, confirming a worrisome trend shift. The annual point-in-time counts showed a 54% decrease in homelessness over 8 years, bottoming out in 2017 at 337 people. But the counts ticked back up over the next 2 years to about 360, and the increase this year, if confirmed, would mark the sharpest rise since the Great Recession. While it's difficult to pinpoint the reason for the increase, the spike in homelessness coincides with rising rental costs in the Lafayette area, as determined by the Department of Housing and Urban Development. Fair market rent for an average one-bedroom apartment in the Lafayette area this year is $795, which is a 9% increase over 2019 and second highest in the state after New Orleans. We are not seeing an increase in subsidized housing. We are not seeing an increase in rental assistance in any way, shape, or form, Rochelle said. We are just seeing a rise in cost and not a rise in supports. More people entered shelters than exited them over the past 15 months, Rochelle said, and that was before social distancing measures forced an approximate 20% reduction in shelter beds, according to the coalition's count. So now we expect there will be even more per month to become homeless, Rochelle said, yet we have literally no resource in terms of emergency shelter to offer these folks because the emergency shelters are full and stagnant. Louisiana stands to gain $8.6 million in CARES Act grants for homelessness assistance, but the state must submit a plan for using that money to obtain it. A spokeswoman for the Louisiana Housing Coalition said she expects the federal government to deliver the money about 2 weeks after submission, but she did not know how long it would take to devise the plan. Until then, state officials consider the $8.6 million allotment to be an estimate, said the spokeswoman Natisha Nat. Nat said she did not know how long it would take to devise the plan, though a listening session with regional housing entities, including the Acadiana Coalition, was scheduled for Monday. Everything right now is still ongoing. It's so fluid. Things are changing every day, Nat said. We are just trying our very best to meet the demand we are experiencing today and foreseeing what's going to happen in the future. The Housing Corporation will eventually administer the money directly to the regional entities, said Rochelle, and Rochelle wants to direct some of the Acadiana proceeds to the region's hoteliers who are badly in need of customers. Hotels were averaging 25% occupancy in the last week of March, said Ben Berthelo, chief executive of the Lafayette Convention and Visitors Commission. Typical occupancy in March is about 70%, he said. Tolerance for occupancy slumps will vary accordingly to the property, Berthelo said, but the recent drop in business is severe enough to present an existential threat to the hospitality industry. I can just tell you 25% is not a number that anybody can sustain for a long period of time. The coalition is attempting to raise $60,000 for hotel beds until CARES Act grants are available. As of Monday, the effort had garnered only $3,580. One shelter director in New Iberia, meanwhile, said his organization is already placing new clients in hotel rooms in the hope that CARES Act grants will eventually cover the cost. Iberia Homeless Shelter, Inc. has booked hotel rooms for 6 families who have contacted the shelter since the crisis began, said its director, Stephen Etienne. 8 existing clients were moved to private apartments, he said. 2 people remain at the shelter, which averages about 16 per night, Etienne said. As the phone calls come in, we just get it done, man. Even if we've got to call private citizens, we've just been lucky to get it done, Etienne said. In Lafayette, the Salvation Army Emergency Men's Shelter had to reduce its capacity from 38 to 20, but the shelter is now allowing men to stay around the clock. In normal times, the shelter is open from 4 p.m. to 6 a.m. and accepts overnight guests on a first-come, first-served basis. Staff that normally works in the Salvation Army thrift store, which is temporarily shuttered, have shifted responsibilities to support the extended shelter hours, helping to stave off layoffs, said Corps Officer Samantha McGee. Curiously, demand for emergency shelter at the refinery mission in Opelousas has noticeably decreased since the pandemic crisis began, said Executive Director Johnny Carrier. The men's shelter typically has 64 emergency beds with a waiting list of more than a dozen, he said. Carrier said the shelter has not kicked anyone out to make room, but it is also temporarily refusing new clients once people leave. There are now about 50 men at the shelter, and new applications are coming in at a much slower pace than normal, Carrier said. Carrier said he suspects that people are just scared to contact the shelter during the crisis. Families being more generous with struggling loved ones is another possibility. It's quite the opposite of what we thought would happen, Carrier said, but I have a feeling there will be a huge influx once this passes over. I think it will pick back up and be probably higher than it was before. Free drive-through meals for Youngsville residents. Restaurant owner is offering a break from stay-at-home life, an article by Megan Wyatt. There's an unusual outdoor party planned in Youngsville this week to cheer up residents who, if not for the coronavirus shutdown, might be spending time at the city's new beach volleyball courts. Agave Mexican Grill and Cantina and Zeus Mediterranean Kitchen will be giving away 1,000 meals on Tuesday to Youngsville residents via curbside service. A disc jockey will play music, and mascots of children's characters will keep people entertained while they wait for their meals. We're trying to do more than just giving the food, Nidal Balbisi, owner of Agave and Zeus, said in a video announcement. It's also about getting people out of the depression mood of being at home all of the time. Balbisi is working with Youngsville Mayor Ken Ritter and Police Chief Ricky Boudreau to get the word out about the social distancing approved party. Ritter posted the video announcement on his Facebook page Monday morning. It's a pleasure to work with Nidal, the mayor said, and I'm happy to be here with him today as he makes an announcement to Youngsville about what he plans to do to give back to our community. The free meal giveaway begins at 5 p.m. Tuesday at 2810 East Milton Avenue. Youngsville Police will help direct traffic during the event. This is going to be a good thing for the community, the police chief said. This relieves all the cooks in the house from having to cook that night, and hopefully everybody enjoys a meal. This isn't the first time Balbisi has given away free meals during the coronavirus pandemic. He gave away chicken fajita meals 2 weeks ago to University of Louisiana at Lafayette students at Agave's downtown location. We feel right now it's our time to give back, Balbisi said, and this is a little of what we can do to give back to the Youngsville people. Agave is known for its outdoor seating and live music as much as its Mexican food. Balbisi is hoping to bring some of that experience back to people during the quarantine. I love you, Youngsville, Balbisi said. I love Lafayette. I love Acadiana in general. I hope this will be a great thing for all of us. I know it's been tough on a lot of people, but you know what? Together, we can make it better. Seems like a good place to insert a public service announcement. The free lunches are still being offered in Lafayette daily at 11 a.m. at the Robichaux Center, which is located at 1919 Erast Landry Road. It's to-go lunches. Only a limited number will be available for pickup. It's first come, first serve, but from what I gather, they've been serving around 400 per day. They're being served from Walk On Sports Bistro, compliments of Drew Brees and the Brees Dream Foundation. They're on a first-come, first-serve basis, so if you found yourself unemployed or underemployed, during the COVID crisis. This is a way to daily get a free lunch. It's at the Robichaux Recreation Center, located at 1919 Erast Landry Road, beginning at 11 a.m. Also, thanks to the Lafayette Fire Department for helping to distribute the meals, and the Lafayette Police Department for helping with traffic and security. Another way to help out our downtown workers. The fund has been created for downtown workers. Money benefits restaurant and bar employees. An article by Megan Wyatt. Employees of locally owned restaurants and bars in downtown Lafayette who are facing financial challenges because of the coronavirus shutdown could soon see relief thanks to a 14-day digital fundraiser known as the Lost My Tips Fund. The fundraiser, which launched Monday morning, is halfway to its $30,000 goal thanks to financial contributions from those behind the initiative. Social Entertainment, Downtown Lafayette, Parish Brewing Company, Robbie Bro and Team, Runaway Dish, the law offices of Matt and Allen, and United Way of Acadiana collaborated to bring the fundraiser to life in the hopes of supporting downtown service industry workers who are facing reduced hours, wages, and tips as a result of COVID-19. Louisiana Governor John Bel Edwards on March 16th ordered bars to close completely and restaurants to limit services to delivery, drive-through, or carry-out only in an effort to slow the spread of the coronavirus. Although social distancing measures are leading to better medical outcomes, they have been devastating for small businesses and those who work for them. The fundraiser for downtown service industry workers launched days after Social Entertainment raised nearly $34,000 through a similar initiative, the Lost My Gig Fund, which is benefiting 106 full-time local musicians whose gigs have been canceled because of COVID-19 restrictions on public gatherings. Service industry workers in downtown Lafayette can apply for financial support by visiting the Lost My Tips Fund on Facebook. Donations can be made to service industry workers via the Lost My Tips Fund page on Facebook or through unitedwayofacadiana.org/lostmytips. COVID-19 coronavirus, the latest, black patients dying from virus at higher rate. Disparity in Louisiana similar to other areas of the U.S. An article by Gordon Russell and Sam Carlin. Roughly 70% of the Louisianians killed so far by the coronavirus have been African American, though black people make up only 32% of the state's population, Governor John Bel Edwards said on Monday. Edwards said he is troubled by the gulf, which, though massive, is similar to those seen in other parts of the U.S. that are reporting coronavirus data by race. Obviously, this is a big disparity, and we're going to try to figure out what that is attributable to and what we can do about that as quickly as possible, Edwards said. Advocates welcomed the decision to release the information, saying that making it public would help the public better comprehend the pandemic. I'm glad the governor decided to release this data because it's a conversation that's been going on for some time now, said Mark Morial, president of the National Urban League and former mayor of New Orleans. It's necessary to help us understand what's taken place here. For weeks, the state has been releasing data on the prevalence of pre-existing health conditions among those who die from COVID-19. Those numbers show very few of the dead had no underlying conditions, and some had more than one. In Louisiana, 2/3 of those who died from coronavirus also had hypertension. Nearly half had diabetes, and 1 in 4 was either obese or suffered from chronic kidney disease. There are significant health disparities between white and black Louisianians, said Alex Bio, Assistant Secretary for the state's Office of Public Health. For instance, about 15% of black people suffered from diabetes in 2015 compared to 11% of white people. So if you go from a situation as a state where you have a significant health disparities and you put something like this on top of it, it's sad, but it doesn't surprise me that unfortunately we're seeing that community be so dramatically affected, Bio said. Several experts said the prevalence of chronic health conditions among black people is clear evidence of lingering structural racism in healthcare delivery. These differences are produced by policy, not physiology, said Amy Lesson, an associate professor and researcher in the Minority Health and Health Disparities Research Center at Dillard University. They're based on race and class bias in the healthcare system, access to health care, and preventative care. While Louisiana health officials have yet to release any data on infection rates by race, U.S. Representative Cedric Richmond, Democrat, New Orleans, said Monday that state health officials had shared some of that data with him. It shows that rates of known coronavirus cases among black people were nearly as disproportionate as the death rates, he said. Richmond said he believes economic and cultural factors may have led African Americans to take longer to self-isolate as the pandemic took hold. If people had to go to work, they may have just dropped the kids at the grandparents', Richmond said. Dr. Camara Jones, a family physician, epidemiologist, and visiting fellow at Harvard University, likewise suspects the economic vulnerability of black people has contributed to high infection rates from a virus that should have been an equal opportunity infector. We're seeing more infection in black communities, and that's because of the front-facing jobs, not being able to work from home, Jones said. We're equally susceptible biologically, but we're not equally susceptible socially. As Morial put it, I think it's pretty clear that the blue-collar worker is unable to do their job from home. Either they're going to work under risky circumstances or they're going to get laid off. The stark contrast in the coronavirus death toll among different racial groups in Louisiana was simultaneously stunning and entirely foreseeable. In other jurisdictions that have released similar data, including Chicago and Milwaukee, coronavirus has likely exacted a disproportionate burden on black people. Moreover, of the 512 coronavirus deaths recorded in Louisiana thus far, more than half have occurred in Orleans and Jefferson parishes, both of which have large African American populations. New Orleans is 59% black, Jefferson 23%. Other parishes that have been early hotbeds of COVID-19 are also heavily African American, including St. John the Baptist Parish, which has the highest per capita death rate of any U.S. county and is 58% black. Richmond said he hoped the data and the coronavirus crisis generally would serve as a wake-up call for Louisiana. We can't be okay with being number one or number two in obesity, in poverty, and being last in health outcomes anymore, he said. We have some of the most creative people in the country, great people, but we have not raised the bar in terms of health and education. Jones said he wishes the sobering data would cause Americans to look inward and to be more compassionate about the everyday people who are now risking their health to deliver the mail or to restock grocery shelves. We need to recognize all of these people who are keeping our society going as doing something in the public good, not just EMTs and respiratory technicians, but low-paid wage earners, people delivering food and keeping the grocery stores open, she said. All of these people have to be recognized as precious and protected with PPE the same way the people in hospitals are. In an article by Blake Patterson, Andrea Gallo, and Emily Woodruff, they can't even say I love you. Coronavirus patients' final moments are often without loved ones. In the hurried minutes before a coronavirus patient is intubated, sedated, and placed on a ventilator, nurses are rushing to set up phone calls and video chats with the patient's family, a chance to say goodbye, potentially, for the last time. The patients usually try and get words out, but they can't. They're just gasping for air, said an ICU nurse at Our Lady of the Lake Medical Center in Baton Rouge. They can't even say, I love you. Just weeks ago, a patient facing a medical procedure could rely on the bedside presence of a family member, squeezing their hand and wishing them well in the moments before they're given anesthesia. But as New Orleans and other parts of Louisiana face a surge in coronavirus cases, hospitals statewide are placing strict limits on who can enter their facilities. The Louisiana Department of Health ordered the restrictions to limit the spread of the highly infectious coronavirus that's left many patients without the nearby comfort of a loved one. Some Louisiana hospitals, including those run by Ochsner Health Systems, say they are making exceptions on a case-by-case basis for dying patients to see visitors in person, but many are increasingly trying to keep their patients connected to their family and friends remotely through phone calls, video conferencing, and FaceTime. As of Monday, 512 people have died from the coronavirus in Louisiana, the bulk of them in New Orleans and Jefferson parishes. And the final moments can arrive sooner than expected. Some patients with COVID-19 are deteriorating so quickly that by the time the hospital has a chance to notify the next of kin, the patient may have already died, according to a nurse who works at Ochsner Medical Center in Jefferson Parish. The health system's chief nursing officer, Tracy Moffitt, said Ochsner staff does everything possible to attend to patients in need of palliative care, including tracking down loved ones. We had a patient that was actively dying, and the only living relative this man had was a son in California, Moffitt said. Nurses, doctors, and respiratory therapists sat down at the bedside, set up a Zoom meeting with the patient's son, and they were all able to be with the patient as he passed. This is the kind of response we're providing to the patients at the end of life. No patient dies alone at Ochsner, I promise you. Robert Hart, a chief medical officer at Ochsner Health System, said Thursday that they are still aiming to bring in family if possible. If there's an end-of-life situation, we have family coming in, he said. While it may be medically necessary to keep visitors out, many hospital staffers who spoke to the Times-Picayune and the Advocate said they have been unsettled by the way patients are spending their final moments. The employees who spoke to reporters did so on the condition their names not be published, because most hospitals have policies forbidding employees to speak to the media about their experiences, even during this pandemic. The newspaper has taken steps to verify their identities. We are not allowing a single visitor at the time of death, and it's very troubling, said a doctor at East Jefferson General Hospital. A nurse at the same hospital said most of the patients she has cared for and who take a turn for the worse often end up dying with just a nurse nearby. These people are dying in the hospital with no one around them, the nurse said. They have no family there. It's horrendous. East Jefferson General Hospital did not respond to requests for comment. A coronavirus patient's rapid decline from stable and cogent to unconscious and unresponsive can occur in under an hour. This has left some families already struggling to keep track of their loved one's health from afar in disbelief. When Sudesh Mahajan arrived at Our Lady of the Lake Medical Center in Baton Rouge with complaints of shortness of breath, his family assured him they'd talk again in the morning. Overnight, the once vibrant 73-year-old was sedated and put on a ventilator. By the time his wife of 4 decades and 2 sons learned of his condition the next morning, Mahajan was unconscious and unable to respond. He died 5 days later, and his family had to say goodbye over the phone. We hope he was able to hear us before he died, said his son, Sajan Mahajan. A nurse at Our Lady of Lake said before coronavirus there were small kindnesses they could offer to loved ones. When families were especially struggling with a death, they would sometimes print out EKG strips showing a patient's final heartbeat. Staff just don't have the time to do that anymore, while family members aren't present to receive them either. And many hospitals are in such short supply of protective equipment like N95 respirators, gloves, and gowns, they rarely let visitors enter their facilities for any reason. That's meant families are unable to privately grieve in the hospital room, said Our Lady of the Lake nurse. Once they die, they can't even see the body in the room, the nurse said. We immediately ship it out to a body bag and have no visitors. Our Lady of the Lake's chief nursing officer, Nicole Tilliard, said the hospital is striving to honor its core value of reverence and love for all of life as best as possible in these extraordinary times. These unprecedented circumstances are incredibly heart-wrenching for everyone, including patient families and our caregiving teams, Tilliard said. The hospital is placing iPads on stands near a patient's beds to allow virtual visits from family and friends. Dennis Richard, a 79-year-old patient hospitalized at St. Tammany Parish Hospital, said goodbye to his daughter, 2 grandchildren, and wife of 56 years over FaceTime. He was asking me, "What are you doing today?" What my son was doing. Just normal conversation, said his daughter, Denise Faraci. He said, "I love you," over and over and over, then blew her a kiss. Tulane Health System and Our Lady of the Lake are allowing priests wearing appropriate personal protective equipment to administer last rites if requested by family. Baton Rouge General is conducting chaplain visits over the phone and allowing hospital staff to assist with last rites. If the family is too far away, sometimes it's the nurses who attend to the dying. They hold patients' hands, and some said they have prayed for the patients. They're still going into the room knowing that they're Catholic because it says that on their chart and saying, "Please God, take care of this patient," one nurse said. Staff writers Matt Sledge and Leah Skeen contributed to this report. Briefs from Wire reports. Texas troopers begin screening Louisiana travelers. State troopers started stopping and screening travelers entering southeast Texas from Louisiana on Sunday in accordance with an executive order from Governor Greg Abbott. Troopers stopped vehicles at a visitors center on Interstate 10 near Orange, about 100 miles east of Houston, and required travelers to complete a travel form, said Texas Department of Public Safety Sergeant Stephanie Davis. She said no one was being turned back. The established screening stations will take place on major roadways, including interstate highways and other high-volume routes, Davis said in a statement. Sunday is the first day troopers conducted the screenings, a week after Abbott's order was issued, Davis said. The order also calls for travelers to self-quarantine for 14 days after arriving in the state. State health officials on Sunday reported at least 6,669 cases and 118 COVID-19 deaths in Texas, up from 6,100 cases and at least 105 fatalities reported on Saturday. Excuse me. Okay. Using a 3D printer, Baton Rouge couple creates face shields, protective gear helping healthcare workers. An article by Wilson Alexander. About 2.5 weeks ago, as coronavirus spread through Louisiana and as hospitals responded to a surge in patients, Dane Caro tinkered with his 3D printer. Caro had co-founded Anvil 3D. He hadn't opened the company yet, but he had the means to print personal protective equipment for healthcare workers. Caro consulted his wife, Dr. Ewan Caro, a family medicine physician at Baton Rouge General Medical Center. The couple wanted to help doctors and nurses as the U.S. faced a dwindling supply of protective equipment. Hospitals around the country had already reported shortages in masks, gowns, and eye gear. Together, the Caros developed a printable face shield. They found help from local organizations, including Cub Scout Pack 15, and have produced more than 300 copies, distributing the face shields to clinics, nursing homes, and hospitals across Baton Rouge. "I'm looking at my nurses and my staff," said Uyen Caro, who works in the COVID-19 wing. "Now we're all masked up all the time." When Dane Caro began developing the face shields, staff at Baton Rouge General had started conserving and reusing masks. They braced for more patients, which are expected to come this month. Caro found designs online. As he printed masks, he showed his wife the prototypes. She tried them on, testing for possible leaks. They tried printing N95 masks, but each one needed to be individually customized. The couple picked face shields, which are the most efficient personal protective equipment for mass production. There are tons of face shields online that people are working together to perfect, Dane Caro said. "We went through them systematically and found the best one that could be the most effective." Once they settled on the design, the Caros partnered with local organizations to help produce the face shields. They found people online who owned 3D printers, and the school board in St. Mary Parish donated 2,600 transparency sheets. Dane Caro organized a small network of 3D printers, sending the owners directions and printer filament. Cub Scout Pack 15 had bought a printer to make prosthetics appendages for children. The pack contributed about 40 face shields. Caro collected the headbands while making dozens with his own printer. He and his wife snapped transparent sheets of plastic onto the headbands. With administrative approval, she distributed them throughout Baton Rouge General. She also delivered face shields to employees at clinics, small hospitals, nursing homes, and dialysis centers. She brought some to Ochsner St. Mary in Morgan City. The shields have provided another layer of protection against coronavirus. Covering the entirety of one's face, the lightweight shields prevent healthcare workers from touching their goggles or adjusting their masks, which reduces the spread of germs. It's another barrier to protect us and have us wash our hands before we adjust it or put any hands to our face, Uyen Caro said. As coronavirus continues to spread through Louisiana, Uyen and Dane Caro plan to produce more face shields. Dane Caro ordered more filament for his network of printers, and the couple started producing mask expanders to alleviate the discomfort of rubber latex straps worn during 12-hour shifts. Whatever they make in the coming weeks, the Caros want to help prevent personal protective equipment shortages in hospitals and clinics around Baton Rouge. When a doctor marries a 3D printer and a pandemic occurs, Uyen Caro said, laughing, "Well, this is what you get." Now, this is kind of a fun story. The real Tiger King, LSU Cam, lets you see what Mike the Seventh's been up to. Article by Robin Miller. Does Tiger King, the hit series on Netflix about Joe Exotic and his big cat sanctuary, have you longing to go see Mike at LSU? Advice from the big cat himself: don't come. While it's not against the law to visit, LSU would prefer you check in on Mike by watching him through the Tiger Athletic Foundation's Tiger Cam, said Ginger Gutner, communications manager for the LSU School of Veterinary Medicine, which cares for LSU's live tiger mascot. Gutner said Mike's caretakers are taking extra precautionary measures to ensure the health and well-being of the university's mascot during the coronavirus pandemic. Measures that were put in place before a tiger at the Bronx Zoo in New York tested positive for COVID-19 on Saturday. She said Mike's caretakers discontinued direct contact with the tiger over 3 weeks ago, just in case it turned out that cats were susceptible to infection with COVID-19. At MikeTheTiger.com and on his social media accounts, Mike is encouraging fans to adhere to Governor John Bel Edwards' stay-at-home order. So maybe a virtual visit is the way to go. And because Mike is a pretty playful cat, it might just be as entertaining as the antics of the now jailed Tiger King. Mike usually makes his appearance about 8 a.m. and roams in his habitat, a roomy 15,000 square feet across from Tiger Stadium, until about 6:30 p.m. He gets to sleep in a little later on Thursdays while his caretakers do weekly maintenance work in his yard. You might catch him splashing in the water, batting around a ball, or snuggling in for a snooze under a big bush. Last week, Mike was offering a virtual hug to get you through the day and a face-to-face with the camera in his night house. The camera has a bird's eye view, making Mike appear smaller than his 400-plus pounds, but close-ups of the big cat and videos are posted daily on Mike's social media accounts, facebook.com/Mike the Tiger, at LSU Mike the Tiger on Twitter, and at Mike the Tiger _LSU on Instagram. And while his caretakers don't have direct contact with Mike, they are still giving him a lot of attention. He has 2 student caretakers from the vet school who care for him for 2 years, Gutner said. They're now training 2 new ones who can't yet do the job by themselves, so there are 4 who are there. And ex-state police and National Guard chiefs emerge in virus response, an article by Sam Carlin. Former Louisiana State Police Superintendent Mike Edmondson and former Louisiana National Guard Commander Glenn Curtis have emerged as players in the state's response to the coronavirus, this time as consultants in the private sector. Edmondson, who resigned his top state post in 2017 amid investigations into questionable overtime and travel by top troopers, is consulting for a group of firms that includes Garner Environmental Services. The Governor's Office of Homeland Security and Emergency Preparedness hired that company to house people believed to have coronavirus next to the Ernest N. Morial Convention Center in New Orleans. Curtis, who retired in December, works for Dynamic Construction Group, the main contractor on the state's massive temporary hospital facility at the convention center, the key part of Governor John Bel Edwards' strategy to quickly increase the region's medical capacity so that hospitals are not overrun with coronavirus patients. Combined, the contracts are worth tens of millions of dollars. Though the exact price tag is in flux in the rapidly moving response to the outbreak, GOSEP hired a Baton Rouge firm run by Joshua McCoy for an estimated $33.5 million for the initial project, which involved building out 1,000 beds and providing material for another 1,000 beds. That price tag is expected to grow because Edwards has already exercised an option to expand the facility to include the extra 1,000 beds. Meanwhile, Garner Environmental Services, a Texas firm owned by K-Solve Group, which also owns Bell Chase-based OMI, was initially hired to establish isolation housing units in Bayou Signet State Park for $12.8 million. But GOSEP changed the contract to have the firm set up trailers next to the convention center for patients suspected to have the coronavirus. Edmondson said he is a consultant, not an employee, for the group of firms, and said he helps the firms navigate state government after a 40-year career spent with the state police. He said he has not had any direct conversations with Edwards, for whom he served as police superintendent, about the deals. Shortly after he retired from the state police in 2017, Edmondson said he was contacted by the owners of the companies to see if he could consult for them. He said the firms have worked on natural disaster response, including coronavirus, in other states such as Florida and Texas. I'm a consultant, Edmondson said. I bring people together, set up meetings, help open doors. Curtis, who was on the floor of the convention center on Monday overseeing the ongoing work establishing the step-down facility for coronavirus patients, said McCoy, the Dynamic CEO, contacted him shortly after he retired to see if he could help with some flood mitigation work through the U.S. Army Corps of Engineers. He said he hired a law firm to give him the ground rules for working with government contracting after leaving office, and he said he stayed away from any work with his former agency. The National Guard, Edmondson said, he avoided any deals involving the state police in order to stay in compliance with state ethics laws. Because of his vast knowledge of emergency response, Curtis said, he agreed to consult on the coronavirus deal, which sprang up shortly after he began working with Dynamic. He added that he told McCoy he wanted to stay away from dealing with state agencies on landing the contracts and instead has been leading the actual work in the convention center. From an appearance standpoint, I said, McCoy and his management team need to work at the state level. I would just work with them on the ground here, Curtis said. I'm going to play by the rules. We're close to out of time this morning, and I think in lieu of the Zodiac, which we can pretty much just, I can skip right down to the end. It's just a fun thing, not based on facts. So let's do something that's a little bit more. How about a public service announcement? For the latest COVID-19 updates and information, you can visit www.311lafayette.services. Call centers with volunteers and medical professionals are active 24/7 to answer your questions about COVID-19 and determine if you need to get screened. You may also call 311 and press option 2 if you're a business owner, employee, or are looking for a job to get information about applying for small business recovery loans, applying for unemployment benefits, and related programs. Stop the spread. Call instead. Once again, you can call 311. And the website is www.311lafayette.services. We have set up a list of services and things that may be helpful to you, some COVID-19 resources on our website at aocinc.org. Just look for local COVID-19 resources, those buttons right there. At the beginning of the page, there's also information on how to submit educational programs. If you are a local educator, we're currently partnering with PACE and the Acadiana Center for the Arts. There's some cool creative programs on air now, programs for K through 2. tips for home production and staying close while keeping distance. So make sure you stay in touch with us there, aocinc.org. We'll be back here tomorrow for our local news program, reading the Acadiana Advocate, and we should have our volunteer back in the ranks. Bruce Cohen will be here with us tomorrow morning from his home studio, so we can't wait to get in touch there. Make sure you follow us, Facebook, we're on YouTube, Instagram, Twitter. We'll keep you posted with the latest news and things going on in the community, and take care of yourself. We're going to wrap this up a couple of minutes early. I've run out of things to announce for you this morning. We've run out of news, and I guess that could be a good thing. Take care of each other, and we'll see you back here tomorrow morning on AOC 1, which is Cox 15, LUS 3, aocinc.org/watch, and Cypress Street Radio, aocinc.org/CS radio. Thanks so much.